Good morning. This is the morning news on WSBA, hour number 3. I'm Gary Sutton.
And I'm Joel Sears.
WSBA news time is 8:10 as I kind of give my nose a little wipe there with a Kleenex. And with us this morning, a very special guest, and he's been here many times, and glad to call him friend. We may differ on opinions every now and then, but isn't that kind of the way it's supposed to be? He's a former congressman. He ran for Senate. He's a former admiral, and very proud of that, and he should be. And for serving our country, Joe Sestak joins us here on the Morning News. Joe, great to have you aboard this morning. Welcome back.
Great to be with you. Thanks, Gary. Good morning, Joel.
Good morning, Admiral.
Always a pleasure, and Happy New Year to you and your family. Wanted to start out as just kind of get your look at a lot of things are on the table right now here in the new year that are going to have to, well, if not at least have some closure, at least work in that direction. We started with Obamacare and the way that has been rolled out and the problems that have been associated with that so far. Your thoughts about all that? Because I know you're a guy who was really in favor of Obamacare when it first came out and when it was first voted upon.
Yes, and I'm still in favor of that Affordable Care Act. I think the implementation was inexcusable. The executive branch of the United States government is supposed to execute. And the fact that the United States government could go to war in World War II against Nazism and Japanese militarism and win it in 3.5 years and not roll out a website in 3 years of preparation is inexcusable. That said, when you step back and look at those 13 states whose governors said, we're going to do both Medicaid expansion and do the Affordable Care Act website, they have upwards of 40% of their goal for the whole year already accomplished. Now, when you take the states like that have decided not to do that, where you have a governor like we do, who said, I don't want to do that kind of stuff, you get about 5% enrolled. So it does take all Americans working together to make something happen. But do I support it, Gary? Yes, for the following reasons. One, right now, 5 million Pennsylvanians cannot be denied care because of pre-existing conditions. Two, seniors no longer have to pay $3,000 for their health care drugs because we're closing the donut hole. And already last year, $750 of prescription drugs premiums given back. And last, and I can go on many more examples, but I want to listen also, is what you now have is no longer will we be losing $100 billion a year because of the under and uninsured in our economy. That's what we lose according to the Institute of Medicine. So if we have, like in the military, people covered with health care, then we're a more effective, efficient working force.
Joe, I think the rub on a lot of this, I don't think there's any question that there was reform needed for health care. You and I have talked about that plenty of times before, and I think we're in total agreement on that. I do think this, though. When we make changes, do we make changes that then we say, okay, we had, 47 million people who were uninsured or who didn't have health care for whatever reason. Now, it seems to me that one of the biggest problems that Americans are grappling with right now, and it's not just on this, it's on this whole idea of redistribution in the economy, redistribution of those who have to those who have not. And I think that's one of the biggest lies ever visited on our country, by the way. You and I may disagree on that. But my point is this. When we make a law, should that law take away the choice of all those in the country, the 85% who were insured in the country or who did have insurance, and now say to them, I can make a better choice than you can, and then you walk out with this abysmal rollout that we saw, and the choices that they make in many cases are far less. They're more expensive. We found out from a president who lied to us that they don't include the doctors that we had before and we were comfortable with. We now don't have access to all of that, and the whole thing seems to be just a secret way of trying to get everybody into a single-payer system. And a lot of people say, when we make laws in our country, should they hurt a larger group while helping a smaller group? I don't think there's any question we want to help those who don't have those things. But why don't we focus on that instead of hurting the larger group and having an underhanded way of going about it and lying along the way? And that's what the president did.
Well, here's how I look at it, Gary, and you raise a great point. Right now, you and I, people who are listening who have private health care before the Affordable Care Act went into effect, were paying about $2,000 more every year because of the uninsured. Because when somebody who's working and uninsured goes into the emergency room, they're more sick, The hospital doesn't pay for it. They make the insurance company pay for it, who passes it to you, Gary, and to me, or to other companies who negotiate prices as part of the overhead with the insurance company. You and I are paying for the uninsured already.
But let me throw this back at you, Joe.
Say, wait a minute, you're going to pay the uninsured. You're going to pay a fair share of it, and now we will be paying for it more directly.
All right.
All of America.
Well, let's take a bronze plan, for example. And I don't have it right in front of me, but I think one of the things in there was a $5,000 deductible, if memory serves. Now, again, that depends on how much money you're given as a subsidy. But you've got basically, if let's say you have a $5,000 deductible. Let's say, I have like a $3,000 or $4,000 deductible right now. All of a sudden, I've got a $5,000 deductible. So all of a sudden, I walk in there and I say, oh, I've got some, thing I've got to take care of. It's not catastrophic. So for $5,000, I don't, let's say I don't have the money. Okay, I'm uninsured at that point. What is the hospital going to do? They're still going to treat you, and we still then have those costs rolling back on the taxpayer, don't we?
Yes, except the difference is this. A hospital can now no longer deny the type of needed long-term care for that individual. So, for example, when my daughter got her brain cancer, I walked into the hospital. She's had 3 brain operations, chemotherapy, radiation. We would have gone bankrupt. Like the majority of bankrupts are caused by mental health. Now, she is going to be, it's caused by health care costs.
Right.
That's the majority of bankruptcies. So what you then step back and say is, wait a minute, my daughter's now going to be a productive member of society. Is that invest in our health care system by all of us, done fairly? And I'm not arguing this was the perfect plan. Just like investing in transportation in Pennsylvania, where 60% of our bridges are deficient. We as Americans, and you're right, we're not that accountable often with our programs by government, but we got a decision to make here. Just like transportation, do we want, like we have in the military, a healthy, working warrior force? Or do we want 40 million uninsured? Because here where I live in Delaware County, Philadelphia, the other county surrounding it, over 60% of the uninsured are actually working. They cannot afford health care. And so we lose $100 billion a year when they become more sick. Is it worth the rich and the poor to come together and have a sliding subsidy scale to make sure we can have a healthy workforce? I saw it work in the military, and I believe it is, just like we invest in roads so businesses can get their goods to market.
But again, when we invest in things, I think it has to be for the overall good of all people in society, and one group should not be hurt. Should everybody else's lives be disrupted to make those changes? I understand what you're saying. I think the idea that we all have to contribute something to society is important, and yet we've seen government and their expenditures and how well they've done with that, and the track record, frankly, is not very good.
When I became a congressman and was sworn in 2007, in the previous 8 years, approximately 160 Pennsylvanians were losing their health care every day. As you know, Gary, and you and I have spoken on this, that's the equivalent of the population of Harrisburg every year. Actually, it's more than that. So you step back and say, do we or don't we want to do something about it? Okay, morally, you want to cover people. I got that. But can we as society, should we afford to come together and have a individual helping to pay as well as society as a whole? And I argue yes, because I come back, it's a cost-benefit analysis. We lose that $100 billion a day, a year, because of the under and uninsured. That's the major reason why I feel we made the decision under Abraham Lincoln to build the Transcontinental Railroad. It's why Eisenhower built the Interstate Highway. And by the way, 76 was the very first highway. And that's why we do things like public education. Philadelphia had the very first public school back in 1684. And what the governor said then was, well, everyone will attend. The rich will pay a reasonable fee. The poor shall attend for free, so all can contribute to the common wheel, as he called it back then. In my mind, we have to make a decision. Is it just about rugged individualism, or is it about rugged individualism in a good alliance with the common effort, the common enterprise? And that's how C6 operates. Rugged individuals, they come together. It means that we have to make decisions, and we'll always have the arguments. Do you want to put X amount into transportation, X amount into infrastructure, X like water systems, X amount in healthcare? I argue we're going to be a much more competitive workforce if we can do and advance and listen to some of the Republicans' ideas, like breaking down state barriers, like letting small businesses come together in association, negotiate with Blue Cross and Blue Shield as a whole, and will be a much more efficient, effective healthcare system and a better workforce.
That's not happening by your party right now. They're not allowing that to get out there. If that were the case and those ideas could be discussed openly and out in front, then I would be right there with you. But that is not happening, and you know it.
That is what's wrong with the political system. Look, I don't mind the harsh debate of ideas, but at the end of the day, you've got to come together. Yes, you're right. Those ideas should have been included or at least discussed in a much more inclusive way. It wasn't. Second, though, once the bill was passed, and you look at 13 states with almost 40% of their goal being achieved by governors and, senators that wanted to make it happen compared to those states that said, we don't want to, well, they only get 5% insured. Then you say, are we taking care of our people? Remember, government is supposed to work for, by, and for and by the people. Now, we have the discussion how you want to use the resources given, but I think when you see a much more efficient, effective workforce from healthcare, and that's the way to go. But if we could include a number of the Republicans' ideas, I think we would have had a better plan.
Joe, there's a diametric difference between the Republican plan that talks about individual ownership of policies and portability instead of a model that works through a third party, whether it's your employer or the government. And those are fundamentally irreconcilable differences in the approach to health care insurance. You can't really have both. If you want portability, that has to be my property. I have to be able to take that policy with me, and I have to be guaranteed continuity because it's my policy. It's not my employer's policy that holds me captive to that job, for example, where I'm fearful that if I go, I then become one of this 160 a day who lose my health care insurance. It needs to be my property and my responsibility.
This is an extraordinarily important point. I argue that we've become a risk-averse nation because people were worried about leaving a company that provided health care and maybe starting off with their own small business on their own, but they have a small child and they can't afford health care by themselves because the plan doesn't go with them. Now, it did it a different way, but what it said is everyone will have health care. How you get it is your decision. Go to a big company or go into the individualized market. And that's how I think, are going to make us less risk-averse. Because the greatest thing we have in America is human capital. And when I met a woman the first time I was running, I said, hey, what are you doing? She said, I just left the company where I was doing the job of my dreams, everything I'd studied for, but they dropped health care. So now I'm at a job just doing hardly anything, but they provide health care. Think about the productivity we lost. So your concept, however you execute it, and we executed it by saying no matter who you are, you will have health care, even if you leave that company, IBM or whatever, is, I think, going to make us a much more innovative, productive, and let's go out and make a great enterprise for ourselves type of workforce.
But a final thought here, Joe, just have about a minute left. What do you say to the person right now who's watching their premiums get tripled? And we're hearing a lot of these stories out there, or doubled, or well beyond the budget that they had planned for this year. And now they're saying, I've got to pay what for health care for a family or for an individual? What do you say to that person right now that's really getting hit for numbers they've never had to pay for before?
Here's what I say, all right? That in the decade prior to the Affordable Care Act going into being passed into law in 2010, premiums had doubled. Since then, healthcare costs, which were rising 8% every year, have been at the lowest in half a century each year since then at 4 or 3%. In short, when people go in and they tell you, oh, my premiums have gone up 3 times, they may be looking at the platinum, the best of the 4 plans. But when you go into that silver, and I've done it, all right, is that for the 98% of the people, they are going to have the same or lower prices. I just talked to 2 people here in Delaware County, and I'm happy to talk to you after the show about what happened in their experience where that happened.
Yeah, we'll have to run at that.
Have a higher cost.
We'll have to run, but those people are still looking at real dollars out there, and I've talked to a bunch, and they're scared to death. So to be continued, Joe. As always, we'll try to figure this one out. Thanks as always for being with us, Joe. Appreciate it this morning. We look forward to talking again very soon.
Great to both of you. Have a wonderful new year.
You too. Thanks again. Joe Sestak with us here this morning on the Morning News.